I guess. So the Ides of March are with us, and I'd like to answer questions that you might have. Not that many people will be able to catch this video right when it starts, and the reason is because I didn't announce it in any way. We're doing kind of a mobile broadcast because I'm not in the office today, but I couldn't bear not having my regular time of answering questions, and I know that many of our viewers would have questions, even though I'm not having our usual, multi-camera in studio broadcast for our stream with Dr. Gwain, which of course we missed Dr. Gwain, but he'll probably be watching along as he's able to between things that he's filling in on my inbox as he's covering for me at the office. So we do have viewers, and we are open to questions and open to the live chat, which we have Bianca and Lindsay both. Thank you, Lindsay and Bianca, both for being here with us. Lindsay asked, I was wondering if it was behind. Oh, let's see, where'd we go for Lindsay there? Lindsay says, there we go. Lindsay says, I was wondering if I was behind on something. No, it's not your fault. It's what's going on my schedule. And of course, we didn't set this up because we didn't know if I'd be able to do it at this time or not. Oh, Rusty's here too. Hi, Rusty. Good to see you also. So this will be dedicated to the viewers. The live chat may or may not make its way to the videos that you can look at after the fact. But if it does, hi, Deborah. Good to have you here too. And Laura. Deborah and Laura, both thank you again for your super chats last week. And you did see that we got the on social media that we got the not Starbucks, but the Dutch Brothers for our director and for Dr. Gwain. Also, T. Lung is here. Hi, good to see you too. May not show us after the fact, but if we do, and you're wondering what's going on, it's because we have this live chat during the live transmission of this stream, and I'm interacting with the audience. If you want to be a part of that, of course, you want to be subscribed and hit the bell icon to not miss notifications for when we go live, like this one. No notice ahead of time at all. It's just the people who happen to get the notifications because they have their notifications turned on that know that we're live right now and able to participate in the conversation like all of you have, like T. Lung and Rusty and Lindsay Antwine and Bianca. Thank you. And Laura Burzak, thank you. We have all of you being a part of it. And there are some things in the news. I haven't kept up with all of the medical news, but quite a bit of it. Okay, Lindsay asked, is the Moderna vaccine better / preferable to the Johnson & Johnson? And I'll say it the way we've said it before, our preferred vaccine is the one that's in your arm. That's how similar versus dissimilar that they are. We definitely want people getting vaccines. Minor differences are kind of hard to compare because they were in different studies. They weren't compared head to head. And so even though you may see these better numbers as far as preventing moderate to severe disease on the earlier two-dose vaccines compared to the numbers from the Johnson & Johnson, they were in different studies. They were in different parts of the world. They weren't in South Africa like Johnson & Johnson was. So it's apples and oranges. I can't say based on that data that one is necessarily better than the other. With further studies with these vaccines being out for longer, we may have some answers that are more appropriate to that question. Based on the numbers, it's easy to say, oh, it looks like it's better for the two-dose ones compared to the Johnson & Johnson. But really, we need to approach that with caution because of not knowing how they perform with different variants. Okay, I'm falling behind on some of my comments here. Suki was in the panic thinking we weren't going to do this today. No, we are, and Bianca, early for once. It's only 11:40. And Bianca, in our news today, one brand of vaccine was stopped. It caused clots. Okay, so, and Lindsay's going to take one of each. Very good, Lindsay. No, two of some of them and one of the other. The question of the AstraZeneca vaccine. This was actually on the Dr. Vaughan's COVID-19 Updates podcast for today, talking about what's the deal with AstraZeneca, because it's not even mentioned in the U.S. It is mentioned in other European countries, not that we're European, in European countries, particularly Ireland and France and Germany, and was it Netherlands? Put a pause on administering the AstraZeneca vaccine, which has not even been talked about being approved in the U.S. yet. And the question is, does it cause thromboembolism or blood clots? And some had occurred in people who received that. The investigation is being conducted even now to see was it the vaccine that caused it or not, because that's a little bit of a question. Those of you who watch us regularly understand that correlation does not mean causation. So it is a question that does need to be asked because it could be from that. AstraZeneca also is known for being the one that was stopped in South Africa because it wasn't found to be effective in actual testing with the variant of concern in South Africa. And it's also been in the news because it's a two-dose vaccine, but they had better numbers in their early phase 3 trials when half of the initial dose was given mistakenly in a whole group of patients who underwent the studies, the earlier studies for it. So it's kind of funny, the information we have from AstraZeneca, and it hasn't had huge studies, if any, in the U.S., at least not completing phase 3 trials like it has in other parts of the world. And part of the requirement that FDA has is that you need to do it here. And I understand that, especially with different variants in different parts of the world, different ones in the UK, different one in South Africa, different one in Brazil. So it makes sense that you'd want to see, well, how does it do in the variants that we have here? Okay, getting caught up on, oh, your hubby had the AstraZeneca. Very good. Especially if he didn't have a blood clot. Sorry, I'm making this so wobbly when I'm reading the... Okay, and then Suki, could having COVID while pregnant cause the baby to have breathing issues? We have no evidence to that effect. What we do know about pregnancy is that you are way better off having COVID when not pregnant. People with pregnancy are much higher likelihood of having significant complications or even death compared to people who are not pregnant but otherwise same sex and age. Hubby had, which is a reason to very seriously consider getting the vaccine if you are pregnant. Virginia, it's hard for me to read. Mulligard. AstraZeneca has a bad reputation in China. Did not know that. It's news to me. Okay, caught up on your comments and questions. And yes, we are caught up. Okay, so if you have any other questions, certainly I am here right now and available for going over those or any topics you want to discuss or talk about here at March 15th, 2021. And again, I'll put out a little plug there for my own podcast. I'd call it daily, but it's not every single day. Most weekdays. We've backed off a little bit here as we've had the vaccines come out and numbers have come down with COVID. It kind of feels like we're coasting a little bit, although here in the U.S. still last week I think we're like 1,400 deaths a day still, even with the numbers having dropped dramatically from what they had been. And still looking like overall we're getting lower, although the descent has slowed a little bit. The numbers aren't going down as quickly as they had been through all of February. Okay, about 2013, a journalist reported on them. Oh, I guess I need to back up and see what that's referring to. Virginia is saying, oh, bad reputation in China. Pharmaceutical companies in China were making big mistakes. About 2013, a journalist reported on them. Okay, yeah, I'm not aware of what was going on with the pharmaceutical industry in China. Although China has its own pharmaceutical industry, they, together with a Canadian company, I think it's called Sinochem, came up with the Chinese vaccine, which was given to the Chinese military rather than doing phase 3 trials. And so since then, though, we've got some phase 3 information on it. And although not as much as the Sputnik V coming out of Russia. Okay, Deborah Ronker, I have a big allergy antibiotic so bad I have an anaphylactic. We got the appointment today for Wednesday or have our shot, but I think you don't want me in his office because hospital is right there. Oh, you mean rather have you in the hospital for getting your shot? That could be. Certainly we'd want you to stay around wherever you get your shot for 30 minutes, full 30 minutes observed by medical staff with the ability to administer an EpiPen should anything happen. Bianca, overwhelming opinion among British scientists is that there is no certain link between blood clots and that Oxford AstraZeneca lab. That's also what I've read too. Yeah, I've also seen that. Don't worry just yet. Yeah, whenever something like that happens, each public health authority in each of the countries, we're talking, I think it's France, Germany, Ireland, I think Netherlands, they all want to do their own investigation and satisfy their own curiosity on that. Suki says, my grandson was born with a pneumothorax and my daughter had COVID while pregnant. So I was just wondering. I have no knowledge of that. Pneumothorax is usually a very physical kind of course, with a newborn, you don't know if it was already there from some kind of underdevelopment or pulmonary hypoplasia, possibly. I can't really speculate too much on that, but for people who have already been born and have a pneumothorax, it's usually due to some kind of issue of increased pressure in the lungs, causing the rupture of the membrane of the lung inside. Or sometimes you'll see it really skinny kids or people with Marfan syndrome stretching, playing basketball, and they get a spontaneous pneumothorax, which not always has to be treated with a chest tube, but that would be the standard treatment, certainly if it's enlarging or a significant size. And Linda, hi, Dr. Vaughan, having vertigo onset today. Oh, I'm so sorry. Have to return your vlog. And Edna, yeah, Vogel, you've been here before. I would love to hear about what medical issues that can be affected badly by anxiety and just a general understanding. Okay, so anxiety and medicine. We will see changes in people from anxiety that you can actually pick up on a blood test sometimes during an acute episode, like if they're having a panic attack and perhaps noticeably hyperventilating, breathing too much. But it can be more subtle than that because there's a couple of things that can influence the amount of air that is moved in and out of a person in a minute's time. There's certainly deeper breathing, so more of a volume is moved with each breath, but there's also more breaths per minute or faster breathing. And both of these can be kind of subtle, or you can have a little bit of both to the degree that somebody watching may not notice it, or the patient themselves may not notice it. But with increased breathing, probably as a layperson, you would think, oh, you're getting more oxygen. But there's another side to it, and that is they're blowing off more carbon dioxide than the body needs to blow off. Carbon dioxide being acidic and very much affecting the acid level of the blood, acid-base balance of the blood. And as you blow off more of this carbon dioxide, the acid level decreases, the blood becomes more basic, and actually more of a change toward alkaline or basic. Change toward it is more dangerous than an equivalent change toward acidic. And changing the pH of the blood and in turn, where all the chemical reactions of the body take place, is a huge thing. And so it can make changes. And so they'll have changes in their nerve conduction. They'll notice tingling around the lips or fingertips or both fingertips and toes and around the lips. They can even get what we call carpopedal spasms, where they have these spasms of their muscles that they have to peel their hands open or breathe in a paper bag to get it back to normal. And sometimes you'll get those symptoms alone without a person really admitting to the anxiety part, and you have to ask some questions. This just happened in our office last week, asking the patient some more in-depth questions about, are you having stress? Was there something going on? Was your business having something going on around this time that may have been on your mind when you're waking up with these cramping and feeling tingly? Well, yeah, as a matter of fact, there has been. Oh, okay, there's our explanation. Now, as far as the tingling, even though I say that acid-base balance is a big deal, it certainly can be, but usually when a person's doing it out of the hyperventilating, it's not going to create a need to go to the hospital or something like that. They'll usually eventually slow down their breathing, get calmed by something before it would really cause any significant problem. So that's one way that anxiety can overlap with real medical I say real medical, with medical issues that you can measure, I'll say it that way. Okay, oh my goodness, who just did that is that Lindsay Antwine? Let me see, let me jump ahead no, it's Laura. Laura, thank you, that's very nice. Always get such information. I'm glad that you appreciate them. You make me glad that I did it today. Okay, and we also have Bianca, as of Wednesday, the EMA said that 22 people had reported formed blood clots out of 3 million who had received AstraZeneca, 22 out of 3 million. So what is that? Somewhere roughly around 1.5 or 15 per million. I'm not good with math that quickly, but not a lot. out of mind. Just reading some reports about it. And also, blood clots are a very common thing. You take 3 million people over however much time these vaccines have been in these people. I don't know what the baseline level of blood clot would be for that. I'm sorry I'm making so much shaking here. It's what we have for our system here. And Laura didn't realize that I had experience with my anxiety. Oh, okay. So Laura also, again, thank you for that super chat. That's pretty cool up there. In BC, T. Lung in British Columbia, our provincial health officer has extended the interval between, I'm sorry, it disappears unless I touch the screen here, between the 1 dose and 2 dose to 4 months. Rest of Canada may be going that direction. Any thoughts? I don't know which vaccine that is you're referring to, because Canada may actually have different vaccines approved than we have in the US. And in the US, let's see, 1 dose to 2 dose to 4, the time between 1 dose to 2 dose to 4 months. Even the ones we have in the US that have 2 doses, it's actually different times. One's 3 weeks and one is 4 weeks. As far as increasing the time, I think what you're getting there, possibly a reason for that, is no decrease in the protection once you get the second dose, although it's longer to get the second dose, but also more people can get first dose while there's more of a limited supply. And then the supply chain can catch up by the time it comes, what did you say, 4 months for getting the second dose? Yeah, by 4 months, they're going to have lots. So you're going to have a lot more protection, a lot quicker for the whole group by making that change from getting it at, again, what was it? Between 1 dose to 2 doses to 4. Oh, yeah, again, I don't know which vaccine or how many if you're talking 3 or 4 weeks to 4 months. Yeah, you're going to have a lot more people with a lot of protection. Your protection from 1 dose of the Pfizer or the Moderna, again, the numbers are different from each of them, but it's somewhere in the neighborhood of 50% at that point. Okay, moving on to Edna, thank you. And another, I can't read from this far away. It looks like CSX, which I think is a railroad. I caught NS 888. Yeah, I don't know what NS 88 is either. Okay, good. Well, we still have Laura's super chat running, so we will stay as long as Laura's super chat is running, because I would not end a live stream while somebody still has their super chat time running. That wouldn't be cool at all, would it? But those are excellent questions and comments, certainly on what's going on in the news right now. In the headlines or on the television or newspapers, the things that are affecting us. And of course, with, okay, let me look up your name again. I shouldn't forget names, but I do. I'm so sorry. Bianca in the UK, with what's going on there with, the AstraZeneca question. That's very much something that you're having to deal with. Let me see, I can jump down to the bottom. T. Lung says, Canada has approved Pfizer, Moderna, and AstraZeneca. Okay, so the Pfizer and Moderna are 3 and 4 weeks. AstraZeneca is 2 dose, but I think the timing is similar to, somewhere around that 3-4 week for the AstraZeneca. Again, I'm not as familiar with it because it's not the one that we're using in the US. Suki, knowing how to control when it happens. Okay, I'm assuming that you're referring back to when we were talking about the panic attacks. Yeah, if you're noticing those symptoms I talked about earlier, it's hard to consciously control your breathing when you're in that anxious state, but you would purposely, try to slow the breaths. Breathing in a paper bag is a strategy that's sometimes used. There's some risk to that because if you're breathing in a paper bag and you don't need to, you're going to be increasing the acidity of your blood, and that's not necessarily good. And I've been learning breathing techniques. Yes, very good. The breathing techniques and other grounding/mindfulness things. Yes, things like Headspace. The Headspace app is something that we've been recommending to people. And of course, I have to give the disclaimer that they provide it for free to physicians, at least for a year anyway. And I have started using it, and I do appreciate it. The big thing is making time for it and committing to doing it. And also, I like taking a IV pack with my hands and pressing to my cheeks. I'm not sure what kind of pack. I think I missed the, may have been a dictation error or something like it. Oh, ice pack. There you go. Laura saying trying Calm app as well. There you go. Calm, Headspace. I'm sorry I'm not able to think of some of the other ones. Oh, Suki. Well, thank you for that live chat. Now we have 2 live chats running at the same time. So Suki, certainly thank you for showing appreciation for what we're doing with the Auburn Medical Group YouTube live streams. And I'm glad that you appreciate it. That's very good. So we have yours running at the same time as Laura's still running. Suki and Laura, I do not know where each of you are from, but that's okay. What's that? That's for coffee. I'm trying not to do the coffee, although I do get those mochas sometimes, which I guess have just as much caffeine, even though I really shouldn't have the caffeine because I'm trying to not get hypertension. And also our friend CSX, Abscess on Video, Auburn Medical Group. Yes, that is our video, the Abscess videos. You've probably seen some of those. Lindsay, talking to Suki about generalized anxiety, panic, and basically, it sucks having it, but it's manageable, especially after you practice what works for you. That's good. Certainly the Headspace would be a good place to go to or Calm to try to find some things that do work for you. Okay, Laura's from Chicago and Suki's from Minnesota. Hey, you guys aren't too far apart, are you? Are those bordering states? No, they're not bordering because Wisconsin's between. I've been to Chicago and I've been to Minnesota, but didn't drive between them. So I'll use that as my excuse for not being sure, but I think Wisconsin's between them. Given my geography that I have in my head that I am referring to right here, trying to remember that part of the country, the United States. So thank you. Yes, Chicago and Minnesota, we're glad to have you coming from there. And CSS talking about watching the videos on the channel, and we do appreciate you doing that. And we still have both Suki's and Laura's, our friends from Chicago and Minnesota, live chat, super chats still running. Suki, close enough about Wisconsin being between Illinois, Wisconsin, Minnesota. Catherine from Vicksburg, Mississippi, thank you for joining us from Vicksburg. We're glad to have you be a part of our live chat about your burning questions. And thank you that most of them are medical. I appreciate that. Actually, I think they all have been this time, which is, they don't have to be, but since it is a medical doctor and medical show, that works out good. Love you right back, Catherine. Thank you for being a part of the live stream. And we do appreciate having all of these viewers and I was going to say listeners. Deborah, good evening. Okay, Deborah, I understand sometimes you need to have your rest, and now's a good time, as good a time as any, although the sun's still out in our time zone, but hopefully that works out for your sleep-wake cycle without messing up. And of course, we have somebody from Australia. We have Andrea from Alidade, and we also have Shirley from Australia. So new. I'm glad we're reaching new viewers. So yeah, we do these live streams this time of the week, which for us is 4:30 in the afternoon on a Monday, but I'm not sure what time it is for you in Australia, but this is when we do them, and we're glad to have you join us. We do talk about medical topics and have a live stream with a dialogue with the people who are watching it live, who can chat in through the chat function on their apps. And of course, if you're subscribed and have the notifications icon tapped to set up notifications, you know when we go live because you get the notification and then you can watch it. And that's for those people who either just stumbled upon us or are stumbled upon us after the live show to see what questions we covered. Lindsay's saying, when can we look forward to non-medical questions live stream? Oh, okay, that would be most likely on my personal channel, which is just called Mark Vaughan. I know there's more than one Mark Vaughan channel, but it's probably one of the bigger ones just called Mark Vaughan on YouTube. And I've not done a lot of live streams on there, although considering doing more of it as the subscriber count's coming up. I am working on a video right now for that I'm editing from some hiking, maybe another one too. We might show you some video of another hike we went on. There's a few hike videos on it anyway. Bianca, I'm fed up with ocular migraines. My eyes hurt. Ocular migraines, horrible things. You might be able to get relief with some blocks. We've been having great luck with treating certain types of migraines with nerve blocks, particularly greater auricular, lesser auricular nerves that cause these migraines that kind of come from the back of the head. And we're able to break the pain cycle on those. And then by breaking the pain, sometimes it'll actually turn off the migraine by the time that the anesthetic wears off. And you can get them for the trochlear nerve and the supraorbital nerve also, although we've not done those in our office, but there's no reason we wouldn't. It's just we haven't had people who have had migraines in those locations to do those. And so that's actually a treatment for relief of the pain as you have it, whereas some injections like the Botox are actually a preventive or prophylactic treatment that you would get to prevent future migraines from occurring. So I'd encourage you to maybe consider finding a doctor who would do that, or if they've never even heard of that, to look into that as an option. I actually got my training for that through a neurology conference at University of Southern California that I was able to attend a few years back, and it was great. Our patients loved that treatment. And Shirley says the vaccine have just started. CSX, did the wax and ear? Yes, we all the Auburn Medical Group videos are ours. Lindsay talking to Suki and Bianca need to go to the optician and see what they say. Yeah, maybe getting better glasses will help. It does help for some types of headaches, although ocular migraines usually aren't related to eyewear, although I won't say it never could be, but it's usually more a medical doctor than an optician that you're going to be looking at. Laura says, my rheumatologist had me submit to be a part of a family medicine test group that takes blood test as part of a research study to look at BCG vaccine as a viable fibromyalgia treatment. Have you heard of this? No, I've not heard of using BCG for migraine. BCG being a vaccine for tuberculosis, pulmonary tuberculosis, in much of the world, although not the United States. My understanding for why it's not used in the United States is because once you've had the BCG vaccine, your skin test for tuberculosis will then be positive for the rest of your life. And in the United States, a decision was made at some point that they'd rather be able to track tuberculosis than to prevent it with the BCG vaccine, which you'd say, well, why would you decide that? Well, because it's not 100% effective like these vaccines that we have now that are 94.5% and 95% effective. It's not that great. And so you're going to have people who have tuberculosis, but you have no screening test to see where it is. And so for some reason, the decision was made that it's better to be able to track it and treat the positive PPDs before people have symptoms rather than to have a not 100% vaccine. That's my understanding of why we don't have a BCG vaccine here. Okay, we are going back to Suki. Headaches that follow the path of migraine but are not migraines. Bianca, GP would be better to go to? Possibly if they're comfortable doing nerve blocks. They don't like when we go to things like teeth, eyes, just to say to go to the dentist. But an optician is not going to do the procedure that I was describing. And Edna, are there any common medical conditions that feel have negative stigma that you feel information helps staying the stigma, I guess? I'm trying to remember the name of the mouth cold sore. You mean like herpes? Which you might be referring to, the herpes virus, herpes simplex type 1, type 2, both can cause oral cold sores, come out usually when people are stressed or their resistance is down. And of course, herpes is known for being genital herpes too. Traditionally, oral herpes being type 1 and genital herpes being type 2. Of course, either one can be either. It just depends on what part of the body, which mucous membrane had contact with a person who had a mucous membrane with a lesion or about to have a lesion or shedding virus to be where they received the virus from or caught it. And so I guess you could say that there could be stigma with that. Not so much in the medical community, although there could be. Who is that? Suki saying type 2, got that one too, which is a horrible, painful, recurrent thing that you don't want to catch if you can avoid it. Laura's saying my headaches were diagnosed as part of cervical dystonia. Neurologist gives the Botox injections. Hey, there you go. So Botox to be preventive, whereas if you had it, these cervicogenic migraine coming from the neck, cervix referring to neck, ogenic referring to something making, so neck making headaches. Giving those shots of the greater occipital nerve, occipital referring to the back of the skull there. Sorry, I keep messing up my my exposure by moving around. It's on auto exposure, just doing it on the phone here today. So I hope that that was helpful information. I'm glad to have so many people participating and to have the live chats and excellent participation with questions that are very relevant and good. I thank you all for coming on this day that we weren't so sure we were going to do it today. We look forward to doing it again next week. Until then, this is Dr. Mark Vaughan telling you to stay in good health.